exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health live stream with yours truly. We've got a great program for you today. Kind of a continuation of some of the things that we've been doing up until now, but with a little different twist. We're talking about traumatic brain injury or things that can cause concussive patterns to the skull. But what we want to talk about is what is the potential of some sort of injury that you've had to your head that has then progressed over a period of time to cause hormonal disruption, meaning your endocrine system not working the way it's supposed to. Everything from your thyroid to your gonads. Ladies, when you go through menopause, are you having a really rough time going through it? Are you having a difficult time going through perimenopause? Guys, are you going into andropause? You know, the growly, nasty, ugly state that you get into and your body's not doing what it's supposed to get done. Those are a result of endocrine disbalances and imbalances and dysfunction and disruption. So what we want to do is I want to take a little different twist on the subject today. I want you to kind of walk through this. You know, everybody outside the United States kind of looks at these possibilities, these potentials a little differently. You know, in Europe, the number one sport is soccer, right? And they're always hitting the ball with their head. And, you know, from even street rumbles and so forth, people are getting hit because they use their feet a lot. But in this country, you know, we know that there's a significance that takes place even up to death with any kind of brain trauma injury. So we're looking for bleeds. We want to make sure that we don't get an athlete back on the field too soon, too quickly, because if we do, we could have an underlying problem that compounds itself over time, and this person could be permanently impaired cognitively, but they also could die. So obviously that's the thing. And even in the NFL, they've changed the equipment, they've changed the rules, they've changed because these young people are getting bigger and faster and more impactful and stronger as the years have gone on. You know, when I was in college and I was playing ball at Kent State University, my height, I was barely an eighth of an inch under 5'10". During the season, I weighed about 218, and I was phenomenal shape. Today, that size of an athlete, and I was middle linebacker, and I played both ways. I was running back as well. But today, that makes a good safety. It's like kids are huge. My young grandson, who is going to college and playing ball, he's 6'3", 261, 262. That's not a small child. And each generation, he's not done growing. He'll, as my son, he'll grow another inch this year. We'll see a kid that's about 6'4", but that's what we're surrounded by. So the impact, the injury. But having said that, I want to take you through other things that can cause traumatic brain injury. And ladies, what happens to your menstrual cycles? What happens to your thyroid? What happens to hormonal function? Guys, you too, then all of a sudden you're younger than you should be, and you have ED, or you just have no desire, or you're a grumpy old guy that you just can't get it together. There's a reason for that. And I want to start talking about it on the 9th, coming up on the 9th of this month at the Roselle Center for Healing in Fairfax. We're going to do a night on traumatic brain injury and what happens when you have these build-up things over a period of time. But more importantly, not only is it the cognitive loss, not only is it disorientation, not only is it the dizziness that may occur, or the movement of your eyes and the not focusing, or the ADD that you might have, all of those things are true. But how about the other pieces of the puzzle that we don't quite put together as a result and finger point towards head injury? But here's the other piece. What other types of head injury can cause the problem? Well, here's the deal that you may not have thought about. Sneezing, sneezing. So here's what happens. Sneezing, when you hold your breath, causes the cranial plates to pop and to jam. And if that happens, spinal fluid doesn't move the way it's supposed to, and the internal organs get hit. They take a blow, they take a trauma. And when that takes place, the signaling from those organ systems aren't going to work the way they're supposed to. So how many of you, you're in public and you don't want to sneeze, and then you get in the habit of doing it, and you go like this and you hold in and so forth? Well, first you're going to put impact on the organ systems of your chest, and you increase the pressure. I'm a diver. I do underwater diving, have for years and years. I do a lot of wreck diving. But if you go too deep, the pressure, the trauma that takes place is significant. You are creating that same type of pressure when you hold your breath. And if you do it repetitively and quickly, and you're going to end up with a problem. How many of you cough or do the same thing? How many of you work out and you're pushing even light weights, but you hold your breath when you're doing that? You're increasing what's called the thecal pressure. That means there's a covering underneath the bone of your skull that attaches the skull. And when you hold that breath inside, you increase the pressure on that membrane, that dura, and that's the increased thecal pressure. And so subsequently, your brain is not going to work. So let's talk about what happens, okay? So if you put your thumb inside your mouth and you go straight up to the roof of your mouth, where the soft portion of the back of your skull is and the front hard part, right at that fissure, right at that crest, right above it, there's a saddle. And inside that saddle sits something called the sella turcica. And inside that is the pituitary gland. Well, your pituitary gland is your master gland. It tells everybody what to do. It produces TSH, thyroid stimulating hormone. It produces FSH, follicle stimulating hormone. It produces LH, luteinizing hormone. It produces adrenocortical stimulating hormone. It produces growth hormone. It produces diuretic balancing hormones as well. So when that pituitary is getting traumatized because you're holding your breath and you're pushing on something, or even a bowel movement, by the way, my friends, you're sitting there, you're constipated, and instead of just relaxing and let it go, you're going like this, you're bearing down, you're increasing the pressure in those cranial bones and in that, around that pituitary. And now that's acting and accumulating like a traumatic brain injury over a period of time. And now you have hormonal dysregulation that is not okay and is going to give you all kinds of problems. So let's talk about that a little bit. Let's talk about what happens with these endocrine dysfunctions after a brain injury. Okay, we'll go to that piece. Endocrine dysfunction after brain injury. But again, I want you to remember that it's just not a car accident. I want you to remember it's not just a blow or a trauma or a fall or smack your head. There are other things that increase the pressure that are as bad long-term, I'm going to use the word bad, but traumatic, dysfunctional, dysregulating than anything else. So traumatic brain injury incurs incredible and substantial health burden to your body. And it's the leading cause for death and disability throughout the world, not just here in the United States, but throughout the world. So whether it's a fall, an injury, crashes, bangs, blows, fights, balls that you get hit in the head, any of those things, but also that those other pieces that we talked about, those increasing pressures within the area, the jamming of it. I'll give you another one that you never thought about, and you've heard me talk about it in other situations before. You go to the dentist, and the dentist doesn't align the temporomandibular joint the way they should. They align your teeth, but they don't align the joint. Now you have a dysregulation, a pumping of the expansion and contraction of these bones, and that all by itself can cause an increased pressure within the skull bones. Now, it's kind of interesting. There's an article that I was reading, came out of NIH again, one of my favorite places to go. And it goes, if I remember, I'm trying to find it. So I think it was 2016 when it was published. So almost 8 years ago, right? So what they said, endocrine dysfunction, and they were following brain injury, and they did quite a significant follow-up of, I think it was 5 years within the study. So here's the deal. They included patients that had TBI, traumatic brain injuries, and they were part of a database that they keep. So endocrine disorders were identified as hypothyroidism, pituitary dysfunction, adrenal dysfunction, many glands they call polyglandular dysfunction, so a lot of different things not working the way it's supposed to, or endocrine. So what they found was that 3 outpatient visits within a year, or 1 admission diagnosis of any endocrine dysfunction that had to relate it to a post-traumatic injury was in this cohort study. And what they did is they studied the risk, if you will, of what took place over a period of time. So they looked at disability and death, but what they really were looking at is all these endocrine disorders, these endocrine, what they called them as post-traumatic endocrine, I feel like I remember, endocrine pathologies, if you will, and the complications that are common and so forth, the thyroid dysfunction, the hypopituitarism, that means lack of function, electrolyte imbalances, and diabetes insipidus, which we touched upon, cardiovascular disease, and so forth and so on. And across the board, the data bore out that any kind of pressure within the brain, in the fluid portion, the spinal fluid portion, so it can't do the job it's supposed to, could in fact significantly be related to traumatic brain injury. Sit back for a second. Think about that. Have you noticed that things aren't working the way it's supposed to? And you've done everything you can to really take care of yourself. But maybe that you haven't explored the fact that there were things that affected your skull. So there's pressure on that pituitary, just like a direct blow to the head or something that happened, a fall, you hit your head and so forth. No, the studies across the board, worldwide, are quite impactful and significant. And when you get outside this country, you're looking at over 1 million different pieces. This is not a minimum cohort study, but somehow we don't take everybody else's information into consideration. In our office, we've had for years. I've had the privilege of treating so many different athletes, Olympians and professional athletes, and even the weekend warriors like all of us, and we do things ourselves that we shouldn't be doing. And nobody's taught us how to work out. Nobody's taught us to relax and let the air out, and we hold our breath and we push too hard. And so what happens is I got a headache. Well, if you got that headache or you feel weird out, you're dizzy, I'm telling you something else is going on. And it's not just an increase in strain. So if that's the case, we really need to pay better attention, and treatment then has to be directed, if you will, to the compression, the irritation within these 22 bones that make up your head. So when a patient comes into us and they're complaining about, I'm not as quick as I used to be, I seem to develop, some kind of focusing problem, and even from a child, forceps delivery, vacuum extraction, women delivering on their back can cause head compression, trauma to a child's brain, and subsequent problems all the way through. That's a traumatic brain injury. Yes, it is. You heard me say it. It is a traumatic brain injury. So when we ignore those things, we're setting up a society that is in a constant state of chronic debilitation. So let's talk about that HPA axis, that hypothalamus pituitary axis dysfunction. All right. Again, where is that? Well, pituitary, we said, is right up in the middle of your head, sitting in a saddle called the sella turcica, and it puts out a lot of triggering hormones, right? ACTH, which is adrenal cortical stimulating hormone, the triggering mechanisms for the gonadotrophins, the LH, FSH, and so forth, TSH, thyroid stimulating hormone, and the like. Now, if that's the case, and we've somehow compromised that because of the normal rhythmic motion of the skull is not there, then we're going to see other things as well. We're going to see inflammatory reactions take place, neuroinflammation, because it helps control it. So now if you have a hormonal estrogen, a hormonal testosterone, a hormonal progesterone, a hormonal thyroid problem, and it's blocked because of inflammation, because the body's trying to regulate itself, do you think that you're not going to have problems with menopause? Do you think you're not going to have problems with andropause? Do you think you're not going to have problems with that transitionary phase? I'm here to tell you, you're going to. You're going to have all kinds of things that are going to take place. And we see it all the time. When you have a growth hormone deficiency, it can affect muscle building. It can be obviously height and so forth, but that can be due directly to an injury pattern that happened early on in life, all the way back to birth. Yes, I said birth, right? So when a baby is not born naturally, meaning in a squatted position, a birthing chair, where the pelvis can open up 30% more, and the baby just comes out, head turns, the doctor catches, instead of pulling on that child, push, pull, start, that head gets compressed. And it gets compressed more than the general molding that goes on. Do you think that it's not going to have an effect over a period of time, either with cognitive dysfunction or hormonal dysfunction? I'm here to tell you, in fact, it is. We've treated so many children over a period of over 4 decades of practice that we're seeing things that don't make sense, decrease in the ability to move muscles and bones, exercise problems. We look at the upper body adding weight where it shouldn't. We're seeing reduced muscle mass. We're seeing osteoporosis take place because that's part of the ongoing process of balance. We're seeing depression. We're seeing disturbances in sleep because of the cranial plates not working the way it's supposed to. So if that's the case, don't you think we better pay attention and have a way to really get this done? It's not okay just to go into your doctor and they say, well, here, take this, it'll help calm your emotions down, or let's get you on some estrogens and without balancing progesterone, let's do this and let's do that. And all of those things make matters worse over a period of time. You may not be as initially irritated, meaning experiencing the symptom that you went complaining about, but you're not who you are. You're not back up to where you want to be. And those hormones that are dysregulated, we call them gonadotrophins, if you will, they're basically peptide hormones. And what we're talking about is LH, luteinizing hormone, and FSH, follicle stimulating hormone. They're, as I said, going back, they're secreted by the front of the anterior lobe of the pituitary gland, and they regulate ovarian function and testicular function. Guys, until the day you drop dead, your testicles are producing testosterone. And your adrenal system helps with that. It's the outer shell around it. So your fight-flight situation is also involved. So in times of stress, those guys aren't working the way you're supposed to because you took some blow to your head at one point in your life and nobody ever fixed it for you. And we can see that by, in our world, we can challenge different cranial plates and test a muscle. If we compress an area that's always already compressed, even by a pound or two of force, immediately on muscle testing, we'll see the muscle weaken, inhibit. So we know it's there. It's finger pointed right there. Fix me. Let's do this right over here. And then putting in pathways. But we're going to talk about that on the 9th of October. I'm going to show you, I'm going to demonstrate to you. I'm going to have a skull. I'm going to show you what takes place. I'm going to show you where the pituitary lives. I'm going to show you how it affects everything else in the system. Join me that night, and I promise you, you're going to learn more than you ever thought was possible. Here's the deal. I want you to think about this through. Even seizure patterns after traumatic brain injury. And it could be a small injury. It could be a whipping action. It could be a torquing of the body and so forth. These patients end up aberrations in different types of hormones. And one is the growth hormone releasing hormone, but is also combined with something called arginine. Now, arginine has a very specific impact in stimulating nitric oxide, which keeps the blood vessels open. So if you're not getting good circulatory patterns to the gonads, your system begins to shut down faster. Ladies, let me tell you something. In the good old United States of America, women have tremendous problems with menopause and hormone dysregulation as compared to other parts of the world. Why is that? Well, it starts early on, like I just said. Sometimes, they're better off the way they deliver children than we do. They actually nurse their children. And so that suckling effect, by the way, is meant to also increase good cranial motion and spinal fluid pumping. So if a child doesn't suckle, then the head is already compromised and compression takes place. And we have the same subtle effect long term as a major blow or trauma to the head. Kind of interesting, huh? So we set up our own situations. And if we don't have that initial stimulus, if you will, to the system, we're not going to produce what we need to produce. Now, we end up seeing other things too, like a hypercalcemia, increased calcific deposits after brain injury. And it can be caused by acute trauma, the stress, the emotional and physical stress of that injury due to the hypothalamus and the pituitary not doing what they're supposed to be doing. Yes, it has a direct impact in how the body balances calcium. So if we see increased levels of osteopenia and osteoporosis, could it be a result of those cranial bones not moving the way they're supposed to? Well, I'm telling you, after all these years, absolutely yes. Because when we're able to fix those things, they seem to get better and don't have all the bad pieces over a period of time and so forth. Diagnosis of low testosterone levels in men and low estrogen levels in women are often directly related to cranial imbalances and injury in the pituitary not signaling the way it's supposed to. So if that's the case, I think we ought to do something about it, right? Well, on the 9th, we're going to do that. We're going to talk to you. We're going to give you some tools. We're going to tell you how to check yourself and how look in the mirror and look at your head. And I can tell you by that direct diagnosis that you're going to say, oh, is that why that's happening to me? I get it now. That's why that's taking place. But more importantly, what can be done about it? Why is it that all of a sudden my sodium level is dropping? If you know your blood work, you have the low in sodium, blood sodium level, salt, 35, and it goes up to about 42, 43, some labs up to 44. And if the sodium level is under 40, 36, 37, I can promise you're going to feel terrible because your fight-flight system, your adrenal system needs to have a higher level of salt. If it's not there, there's multiple systems that are not going to work, but it can be due to severe injury or subtle injury over a period of years. So what else can cause that? So believe it or not, hypoxia or low oxygenation can cause a traumatic impact to the brain and the triggering mechanisms that have been associated. We've been seeing a lot more of that lately. Why would you think that may be the case? Why would you think that we're having more and more patients present with low levels of oxygen saturation, but also hypoxia on stressing and testing muscles? Gee, do you think it could be because all of us were wearing masks for several years, starting back in 2020? Do you think that might be the cause? Maybe something to think about. I'm here to tell you that may be something, and people still out there. We have in our building, there's a exercise training group downstairs. And during COVID, I saw them outside in the parking lot with nobody around. And they had their clients with a mask on doing sprints. Do you think that doesn't cause a problem and perhaps even long-term impairment of some, other mechanisms? Think about it for a second. I'll let you draw those conclusions. But where my brain says, yep, I think we may have to look a little deeper for some more answers and see what's really taking place. But I want you to understand that the cranial bones, the plates of the skull, the head, the membranes, it's called meninges, this attachment to the skull, can be injured for many reasons. It can be a traumatic blow to the head. It can be holding your breath and sneezing. It could be a birth trauma that has never been cleaned up. So all of these areas, unfortunately, are not looked at, except when we take a look at a patient. So when you see these mechanisms that are showing up and your doctor says, I don't know why, well, you're fine, you're within the standards. Well, it's not the standards. You got to look how it's affecting you. And then a lot of times those words come out because they don't know where to go. They don't know what to say next. And since they're the white tower guys, we say, okay, I got it, whatever. But we're getting smarter as a society now. We're understanding the mechanism better. We understand that, if we have the information, that we can do our own analysis, as you should all the time. I want to give you what you need to have. Join me the 9th of October. I promise you I'm going to get into this in depth. I'm going to show you also what can change and how you can fix it, what you can do to make a difference. Some things on your own and some things that need to be done. But we're going to talk about those and we're going to put it together. You're going to have a great night understanding some things that nobody else is telling you about except for, moi, good old me, right? I'm the guy that sticks my head out for you, and I want you to understand that you deserve the information. Next week, when we come back on Ageless Health live stream and also on WML 105.9, there's going to be a very, very dear friend who I've known for over 4 decades, who is probably one of the best and brightest when it comes to traumatic brain injury. He just published a new book. It's called, Dr. When Can My Child Play Again? He was the chiropractor, applied kinesiologist for the Kansas City Chiefs for over 13 years. An amazing intuitive man, one of the best teachers in the world of applied kinesiology. Dr. Evan Ladnoff out of Kansas City. You're going to enjoy him. We'd love to go back and forth. We call each other photon twins and photon brothers, but you'll enjoy this man. He's a great guy, tremendous amount of information, and we'll get into some things. And by the way, if you have any questions, always send me the questions. And if we're here online, during the program, and you can text me because I can pick it up here, and I'll pick it up and we'll answer the questions. Having said that, remember, I'm here for you every week for one reason only. You deserve the information, but more importantly, I love you all. See you then. Bye. Ciao.